I f***ing hate this thing. But it is a very helpful, quick, and easy way to neurologically assess a patient, whether you're doing serial neurologic exams or classifying traumatic brain injury.
There are 3 categories for a total of 15 points, and the lowest score possible is a 3. The way I like to remember this scale is by the letters E, V, and M for eye, verbal, and motor response. This is the easiest way for me to remember and assess a patient since the allocation of points is 4 points for eye response, 5 points for verbal response, and a 6 for motor response. So when a patient comes in for the first time, I mentally ask myself, what is this patient's EVM? So let's go over this individually. A patient could get a total of 4 points for eye response. You need to ask yourself, are they moving their eyes normally or spontaneously? And if so, they get a 4. If not, then you need to ask yourself, what does it take to get this patient to open or move their eyes? If you call out their name or yell at them and they respond, then they get a 3. If you have to shake them, pinch them, or sternal rub them to elicit an eye response, then they get a 2. If you cannot get them to open their eyes with whatever you do, then that's bad. That would be a 1. In regards to a patient's verbal response, you need to ask yourself if this patient is talking to you normally. The way I like to assess this is to ask the patient 3 questions regarding person, place, and time. For example, I ask the patient if they know their own name. Do they know where they are? And do they know what year it is? If they could answer all 3, then I would give them 5 points. If, for example, they don't know their own name or don't know the current year, then they would be disoriented and I would give them a 4. If the patient answers inappropriately, for example, banana for their current location, then that is a 3. If the patient is mumbling, incomprehensible, and moaning, that is a 2. If the patient isn't saying anything, that's obviously bad. That would be a 1. Finally, for the motor response. If a patient can follow commands, I give them the total points. If the patient does not follow commands, they are likely pretty confused or seemingly unconscious. So the next thing to do is try to get them to move by applying a painful stimulus. Typically, I like to take the bell of my stethoscope and press real hard on a finger or toe. If the patient pushes you away, then they're localizing. You would give them a 5. If they pull away or withdraw from pain, then you would give them a 4. If the patient has abnormal flexion or decorticate posturing with painful stimulus, that would be a 3. If the patient has abnormal extension or decerebrate posturing, that is a 2. And if the patient isn't moving at all with a painful stimulus, that would be a 1.